so I am Dr. Kashiti Long. I am a primary care doctor, and I have Long Health and Wellness is the name of my primary care clinic, and we are a personalized primary care. And okay, so this is my little about me collage. This is my dog Gypsy. She's a Shih Tzu. She turned 6 yesterday. So she got a little birthday treat for that.
She's a cancer too.
And then this is a pic from my grand opening with some of my family members. These two are my parents. And this is part of my garden. If you've done a one-on-one with me, you know I grow vegetables. This is some more family from when my sister graduated from boot camp for the National Guard. And the rest of the pictures are travel pictures because I do love to travel. So the lion in the background is in Kenya, the swing is in Bali, four-wheeling in Costa Rica, snorkeling in Aruba, and just at the Coliseum in Rome. So there we go, the life and times of Dr. Long. All right, so Long Health and Wellness is a membership-based direct primary care practice that provides quality, accessible, personalized primary care through a direct relationship with the patient and the doctor, which means we cut out the insurance middleman. And so that means we have a membership-based healthcare model, and so you pay a flat monthly fee instead of using your insurance. And that covers everything that goes on in the office. There's no extra copays or deductibles or surprise bills afterwards. And so you get more time with the doctor and fewer insurance hassles. And so this is a comparison between direct primary care, which is what I do, and traditional care. And so we have a membership fee, which you don't traditionally pay, but we have no copays or deductibles. And then you get unlimited visits. So whenever you want to come see me, you can either self-schedule through a link that you'll have, or you can just text me and I'll say, okay, I'll see you tomorrow. And then you also get longer appointments. So our appointments are generally 30 to 60 minutes instead of the 10 to 15 in a typical office. And I know you really well because it's a smaller panel of patients. So instead of having 2,000 patients, I'll maybe have 300 patients. So what is included in primary care? Because not everybody knows that. So it is going to be your preventive care, so your routine screenings, which depending on your age could be a pap smear, a mammogram, other cancer screenings, chronic disease management, so things like your thyroid problems, high blood pressure, diabetes, asthma, anything that goes on chronically. Acute care includes whenever you're sick, so if you have a stomach ache, upper respiratory infection, this pain that you don't know where it's coming from. All of that's in acute care. And then women's health, which is important to this room, is going to be all your hormone health, your perimenopausal support, contraception, preconception counseling, all of those things. Mental health, because everybody's stressed out these days, so I can help you manage your anxiety or depression. And then lifestyle medicine as well, which is another certification that I have. So my base training from residency is internal medicine, which means I see adults 18 and over. Optional training that I did was lifestyle medicine, which is all of these things here. Your nutrition, physical activity, stress management, sleep, social connections, those all contribute to the overall picture of your health, and they're often overlooked. And so that's something that I emphasize, because if these things are right, you live a much healthier, happier life. And so how DPC saves you money is going to be no copays, no deductibles or surprise bills. You also have the option of opting for cash, labs, and imaging, which can often be cheaper than what is charged to the insurance plan. For example, the typical panel of your annual labs, like your blood counts, electrolytes, kidney function, liver, cholesterol, diabetes screening, that's like $30 if you pay cash. If you pay your insurance, it's whatever, probably $300. And then prevention, when you have a good relationship with your primary care doctor, you're less likely to need to go to the ER or the urgent care. And so one ER visit is at least $1,000. So if I could save you that, then that pays pretty much paid for your whole year of membership. And so those are some ways that you can save money. And then, so what are the prices? So my base membership is $129 a month. So that is everything I've already said is just $129 a month. If you are like, I'm too busy to go to the doctor, I need a doctor to come to me, I'm willing to do that, but it's gonna cost more, right? Because it takes me more time. So if you would like an at-home membership where I come to your house and see you, then that is $329. And then if you just have this one thing that's bothering you that your doctor doesn't have time to talk about, and you just want another opinion, then that one-time visit is $379. And so yeah, that's pretty much it with that. It's also great for small businesses. A lot of small businesses, if you have just like 2 or 3 employees, you can't offer them health insurance. It's too expensive. And so I am an option for giving them some type of healthcare benefit so that they're more likely not to leave so they can go get health insurance. And then also entrepreneurs themselves, buying your own health insurance can be expensive sometimes. And so if you want to get good quality primary care, and save some money, you can also have a membership for yourself. And
That's a great option.
so this is the summary of the benefits. It's convenient. You get more holistic care and more time with the doctor, and it can be very cost effective. I think that's the last slide. Here is my contact information. So you can visit me at longhealthandwellness.com. I am on LinkedIn and Instagram at Kashiti Long MD. And then what questions do you have? Because I know you have some.
I have a question. Okay, so thank you. This is amazing. I admit I didn't know much about that. So and we're gonna do a one-on-one because I want to know more. Tell me about how prescriptions, because I'm on a prescription that I have to take forever.
Yeah, so basically you tell me what pharmacy you wanted to go to, I put it in the computer and I send it to the pharmacy.
Okay, and then is that covered by insurance or?
So yes, if you are on a prescription and your insurance has been paying for it, they'll continue to pay for it.
It doesn't matter about the prescriber?
It does not.
Okay, great.
So, this is where my question always is, because like, this makes way more sense to me anyway, but like then just that extra, like, you would still need some kind of insurance to cover certain things, but like not, it sort of takes the like extra, like the monthly payment for, well, you still have your insurance. I guess we change your insurance.
So,
Go.
Yeah.
Let it go. Read my mind.
So the idea is that you can choose a less expensive insurance plan and have a lower monthly premium for your health insurance. And so therefore it's there for big things. Kind of like your car insurance is there for big things, but you don't use it for your oil change or your routine maintenance. And so opting for a less expensive health insurance plan just to cover you for like if you get hit by a bus or if you have a medication is where you can kind of balance the monthly savings.
I think this is brilliant. I really do. I think this is the wave of the future. Every time I hear you talk, I'm like, she is so smart. This is like the way it should be because I can't get a doctor's appointment. Half the time my kid is sick and it's like, I'm on the app and it's like, oh, like it's here next week, like even myself, it's like you can't get it. So this is brilliant. You have somebody who's your doctor instead of having like an app.
Yeah.
And so if someone was to come to you and just do like a one-time thing, but they already have a lot of things going on, how do you address that, or how do you work with that kind of situation?
So for the one-time visit, it's just for one thing. If you want to address like the multiple things, you need to join the membership.
Got it.
Any other questions?
Oh, and I have one more question. So if you join the membership like this year, when there are rate changes, are you locked in, or like if you up the monthly? Or
Well, I don't plan on upping them monthly anytime soon. But if, say, in 5 years we need to adjust for inflation, then it would just adjust.
Yeah.
But it wouldn't be a huge jump or anything.
Okay.
Is it always month to month, or do you have a term? Like, we're gonna be month to month for a year?
So you're not locked in. You can cancel at any time. I just ask for 30-day notice.
It should be the way. This is the movement to get rid of insurance.
I'm seeing a lot of people switching.
Well, but I will say you're affordable, which I think is, I think the initial movement towards this, people, it's like
It's a couple
crazy.
$1,000s a year for.
Yeah, and
most
you're like,
years.
but I go to the doctor hopefully once a year, why am I, you know, so I think,
Have it for that, just in case.
I was very surprised and also think that's really.
Do you have family plans or just, is it individual?
So I only see people over 18.
Okay.
So the family plan is, I guess if you had an adult child or a husband who wanted to join, the second person gets 10% off.
If you have insurance, can you file your visits so they go towards your deductible?
No, because of a billing and coding thing, but you can use FSA and HSA cards if you have those. That you can just use that to pay for it.
If you wanted to give your employees this, and do you have like a contract or some paperwork already set up, so like if they go in and you have to bill them
For something
$500 more
else.
for something, that the employer would be responsible for it?
Right, so the employer would pay the monthly fee and the employee would know that if they chose cash labs or something like that, then they are responsible for any additional fees.
Okay.
What forms of payment do you take besides the FSA and HSA?
So it's whatever card you wanna put in the system. Like, I'm not actually taking any money in the office or anything like that, so no cash, we're not bartering with chickens or anything. Whatever card you wanna put is how you can pay.
The chickens would be good for the garden.
That's what I
You may wanna change your mind on the chicken bartering.
So, you know, I've thought about chickens, but then I saw a video of somebody with a snake in their chicken coop, and I was like, I don't know about that. Yeah. All right, thank you guys for having me. Let me know if you have any questions.
Thank you.